Can't wait to get back and get on a flight somewhere. All right, since the pandemic began last year and life became unpredictable and stressful on every level, many people reported noticing a troubling side effect, their hair falling out. Did that happen to you? Doctors around the country noticed an uptick in patients of theirs suffering from stress-related hair loss. In fact, Google searches for hair loss have increased, up to around 850,000 searches per month. Our next guest has some good news for us. This phenomenon is not permanent. Do you hear me? It is not permanent. Don't worry, boo. And there are therapies available to speed up regrowth. Dr. Sarah Wasserbauer joins me now, and I'm so glad to know, first of all, Dr. Wasserbauer, good morning. It's not permanent, because I think something like this happens, you think, oh my, fill in the blank. What is happening to me?
Absolutely. Well, and the first thing to know is just don't listen to Dr. Google, because Dr. Google is going to freak you out. And this diffuse loss that happens all over the head, either as a result of the stress of dealing with a pandemic, a worldwide pandemic, or as a result of having COVID-19, is usually reversible. If you have underlying genetic hair loss, that's kind of a different thing, but this big diffuse shedding, that's reversible usually and very treatable.
Diffuse shedding as opposed to clumps falling out or even just like a little patch falling out. Differentiate between those for me.
Yeah, so if you just have generalized overall shedding, that's something called telogen effluvium. Now, there are different types of hair loss that are brought on by the stress of COVID-19 or even having COVID-19. That would be something with a fancy doctor word called alopecia areata, or some of these other medical terms that I won't go into, but they all scare people, because even if it is a clump, sometimes you can't differentiate. You need somebody to look at your scalp. So those are things that people can do. Just go see a reputable hair doctor, and there's a lot of treatments that we can use to turn it around.
So hair doctors are out there, and I think will surprise many of us. You're a hair doctor yourself. At what point should you seek treatment? If you're getting sort of like clumpfuls and handfuls coming out, we all shed a certain amount of hair every day, every month.
Yeah, well, the sooner the better. So if you're experiencing over 100 hairs a day as averaged over a week, so don't just go for, sometimes you could have 300 in one day and then, 10 the next day. So average it over a week. Anything less than 100 hairs, that's going to be normal shedding, and it'll probably resolve within 3 to 6 months.
Wow.
But if you have more shedding than that, or if you're noticing a patchy hair loss as opposed to diffuse across your head, that's the time to definitely see some care.
And this is a little different from hair changing as we age, right? Because as we're getting older, there's changes to our hair. If you're on certain medications, there may be changes to our hair as well, correct?
Yeah, nothing grows as well as we age. Our skin, our nails, nothing goes quite as well as it was.
That's the good news, right?
So yeah, that's called senescent or age-related hair loss. Age-related hair loss is definitely a thing. And there's things that you can do to turn that around too. Low-level light therapy, minoxidil, even some nutraceuticals that are out there. And hopefully in the future, I don't want to tip my hand, but some hair rejuvenation therapies with cloning might even be on the rise.
Cloning my hair follicles. That's amazing. Okay, let's talk about some of the therapies that are available. You just talked about the light therapy. That sounds kind of cool and non-invasive.
It is. It is. It sounds like a gimmick because everybody has read it in the back of In-Flight magazine. I know you have.
Yes, I have.
But there's definite, we've had proof since the 1960s that light of a certain wavelength, if you can get it to the scalp, will actually regrow hair. They have a couple of famous mice. You can Google the famous hair mice. Look up Dr. Andre Mester. And of course, there's other things that help with hair loss that people have heard of, finasteride and minoxidil, that would be Propecia and Rogaine. But what I got to tell you is that if you're looking to prevent COVID-19,
yes,
because we're talking about COVID-19 and hair loss, finasteride might actually help prevent COVID-19 and might actually help you get less severe disease if you get it. It's kind of crazy how COVID-19 and hair loss are really interrelated.
That I would not have known that. That's really, truly amazing. And then there's also a treatment that involves platelet-rich plasma.
Yeah, so a lot of what's happening in the hair loss industry is figuring out which growth factors inside the body can help stimulate hair growth. One of them is inside your own platelets, platelet-rich plasma, injecting those back into the head. Another one is kind of new. It's called exosomes. It's getting a lot of buzz. We're waiting for some more data in those cases. But using your own growth factors to stimulate the growth of this hair is really what we're looking at there.
You know, doctor, like just a quick consult for me, because really frustrated by the fact that hair grows not where we want it, but where we don't want. Like, why do we have hair on our toes, doc? Like, I don't need a hairy toe. You see what I'm saying?
I don't think we were meant to be hobbits, but I do understand that. I do get it. As you age, different receptors on these hair follicles will wake up. So if you were a guy, you'd say, hey, how come as I age, my eyebrows, my back hair, and my ear hair all wake up?
Yeah.
Well, this is how we know that God has a sense of humor. The same stimulatory receptors that exist on the hair also make these inhibitory. So you're losing these. Well, these are getting stimulated.
It's just not just. You're right. He's laughing. She's laughing.
Fair, but that's the humor we have to deal with in life.
Absolutely. You know what? I think any patients that get to see you are delighted to know that you've got such a great sense of humor and a great way about you. That bedside manner that is really going to be just a selling feature for you.
You're very kind.
No, it's the truth. And bottom line, any sudden loss of hair, consult a hair professional, consult a doctor to get some medical advice to know what to do. That's your bottom line.
And if you can't find a dermatologist who really specializes in hair, there's a board certification you can look for somebody to prove that it's called American Board of Hair Restoration Surgery. You can look on those and find really good doctors there.
I love it. Okay, Dr. Wasserbauer, I have a bit of a girl crush on you. You're fantastic. Thank you so much for this. This has been really instructive for all of us and a good reminder, because stress impacts our bodies in various ways, and this is one of them that we're seeing. Good to see you, doctor.
See you later.
Okay, you stay well.